we as healthcare consumers, it's the one industry that you really can't get clear pricing on something before it happens. So the level of, I always talk about that. We've talked this week a lot about mission moments, but I think most of us have some sort of health care experience that brings us to, this really doesn't make any sense. I'm stressed out. I've taken care of my health. I run into something that does require me to leverage my insurance. I don't really know how to navigate it. And I have no idea how much this is going to cost me. I've been in the industry for a long time, and I still think that's challenging. And I think we're all caretakers and also consumers of health, right? Of health delivery. So for price transparency, it's really about being able to bring just that transparency to patients and deliver. I love the word application from the application development side. I mean, there's a reason why that word is like actually applying the data and the technology to deliver value, the application of technology to deliver value to our end user. And so the member that's consuming price transparency should be able to say, hey, I'm about to go into this knee surgery, or I've just got a cancer diagnosis. How much is this? And right now it's more like, how much is this procedure going to cost me? But I really think we need to get towards the future roadmap of like, how much is this overall health condition? What does it mean for me and my financials? What type of insurance? I think there's a definite roadmap to the conceptual value delivery to people that are shopping for healthcare versus right now where it's just starting. First, we had to deliver machine-readable files that, go procedure by procedure by health plan. How much does this cost?
I think that's really interesting how you kind of put that, because when I hear about price transparency, it almost sounds like we're always dealing with some acute anomalous condition. Like, I've broken an arm. How much is that going to cost? But if you look at something like, for example, a cancer patient where the journey is much longer, there's many different milestones and setbacks and switchbacks. There's a lot of different things that affect their ability to manage their treatments and manage their lives. A lot of costs in there. So I think it's really interesting for you to look at price transparency from a holistic journey rather than a singular episode.
Because it goes back to the theme that we've been talking about since the beginning of this podcast, is going beyond the regulation. And the regulation is providing that kind of quote or that price transparency. This is what the estimated cost will be. But it's then, okay, here's how we, believe it or not, an insurance company could help you out with this. And it is that financial, because that's part of the anxiety, because you're dealing with a member. Let's stop talking about it from a member perspective, right? We're dealing with a person who is going through something that is very, very stressful. To add a financial level of stress on it isn't going to help their physical health at all. So how can we, whether we're payer, provider, or in combination, partnership between the payer and provider, how can we do more to, help the outcome of that person?